Hello guys, hope you are all okay and you are all enjoying whatever you are doing. If you are practicing medicine, hope you will be enjoying that. If you are doing physiotherapy, you will still doing the good job. And those who are writing the reports and they are radiologists or trainee radiologists, again marvelous. And those who are doing ultrasound, still I appreciate. So these are all the modalities we are in one way or the other helping the community at large. Today I'm going to discuss about the Kohler's disease. Kohler disease is a childhood disease. It occurs, it happens in the childhood or in the children's as well, but it may occurs in the adult. But in the adult, the name would be changed. That would be called as Mullary-Weiss disease. If it happens in the childhood, it would be called as Kohler disease. What is Kohler disease? Kohler disease is osteonecrosis of the tarsal navicular bone. If the navicular bone gets thinner, sclerotic, that would be called as a Kohler disease, quite common and can be seen in second up to 4 years of life. So this is the common thing. The patient complains of severe pain and the patient will brought to the department with that complaint. That would be actually osteonecrosis. Most of the time, again, GP considered there might be a small fracture. We cannot think of insufficiency fracture in the childhood, but there will be some other features of the fracture like sports injury and all these kind of a stuff, and we forget that there might be a osteonecrosis of the navicular bone, and this would be a Kohler disease. For that, what you have to do is you have to advise the patient's X-ray, foot epi and lateral view. In both projection you have to look for the navicular bone, and on the navicular bone what point you will pick. There will be a sclerosis, the first thing. The second thing is this would be a very thin navicula, that would be a like wafer, so thin like a wafer. This would be the second important point on the X-ray. And the third thing is, immediately when you see the X-ray, so just on the top of the calcaneum there will be a talus, and then the navicular in front of the in front of the talus, the navicular will become a so thin enough that you will easily pick that this is a thin navicular and this is the Kohler disease. So how it will appear on the ultrasound, on the X-rays, on the CT scan, let's start watching these images and it will surely help you to manage your patient in the clinic. And if you're physiotherapist, in the physiotherapy department, and if you are reporting and you're reporting radiologist, so it will help you to pick the point quite easily. So let's look for the Kohler disease. This lateral radiograph of the foot, you can appreciate the navicular bone. The first point is navicular bone is thin, it is wafer like, it is sclerotic. Adjacent calcaneal bone is normal, talus bone is normal. However, talar beaking can be seen here, because whenever there is a avascular necrosis of the navicular bone, there is collision may take place. As a result, talar beaking can be seen, but this is avascular necrosis of the navicular bone, which is called as Kohler's disease. Here another the two radiograph in AP projection and the lateral projection, clearly showing that the navicular bone is sclerotic because of the non-supply of the blood, and this is avascular necrosis, which can be seen on the lateral and AP projection both. If you see this in a close view, so again this is the navicular bone, very thin bone can be seen in view. On the top image you can see this is wafer like navicular bone because of the avascular necrosis. In the lower down image again you can see a very thin navicular bone, and this is what the Kohler disease is and can be easily picked on the simple radiographs. This is the AP and lateral projection of immature skeleton, and here you can appreciate very clearly visible small thin sclerotic navicular bone of the Kohler's disease. And Kohler disease cannot be missed on the simple plain radiograph. It's the easiest modality to pick this Kohler's disease, and this is how it will look like. It would become sclerotic, it will become small, thin and wafer like. So this is Kohler disease in the children. For the clear understanding, again, this is an AP projections of the foot, and where you can see small, thin, flattened navicular bone, and this is because of avascular necrosis. It appears sclerotic, and it also appears thin. Sometimes it appears fragmented, usually seen in childhood, and this may be associated with the soft tissue swelling as well. So this is Kohlar's disease, can be seen on the simple radiographs.